Hello, my name is Melinis. I'm the Medical Director of the Transplant Infectious Disease Program here at the Yale School of Medicine. Today, I would like to discuss our exciting clinical study involving HIV transplantation. Before we start, I would like to introduce the key members of the HIV transplant team of the Yale New Haven Transplant Center. Our team is composed of experts in the field of transplant infectious diseases, HIV, renal disease, and transplant surgery. Yale New Haven Transplantation Center is a destination center for patients from around the world who are candidates for liver, kidney, pancreas, and heart transplantation. Our center has experience in kidney and liver transplantation of HIV patients since 2010. More recently, we have successfully performed a heart transplantation in an HIV patient. As a result of effective antiretroviral treatment, HIV patients are living longer and likely to die from other comorbidities rather than their HIV-related complication. Up to 30% of HIV-infected patients have renal dysfunction that could be from hypertension, diabetes, cardiovascular disease, or HIV-associated nephropathy. Once an HIV patient develops end-stage renal disease and becomes dependent on hemodialysis, the 5-year survival is expected to be lower than their HIV-negative counterparts. Renal transplantation from HIV deceased donor to HIV recipient has been performed in South Africa by Dr. Elmi Muller. Patient and renal graft survival outcomes were encouraging in more than 30 patients who benefited from the procedure. In 2013, President Obama signed the HIV Organ Policy Equity Act that allows the use of HIV disease donor organs for HIV patients in clinical research settings. On March 16 of 2016, the first HIV to HIV renal and liver transplantation in the United States were performed at Johns Hopkins University. The organs were obtained from a deceased HIV-positive patient at Yale New Haven Hospital. Yale was approved by the Yale Institutional Review Board and the United Network for Organ Sharing last June 3, 2016 to participate in this HOPE Act study. The aim of this study is to evaluate the safety and outcomes of HIV-positive deceased donor kidney transplant for HIV-positive recipients. HIV patients who meet standard eligibility criteria for transplantation and are willing to accept an HIV-positive donor will be enrolled in the study. Enrolled patients can accept either an HIV-positive or HIV-negative donor depending on the available donor organ offer. To be included in the study, patients should meet the following criteria: only adults of 18 years of age and older, patients who have no active opportunistic infection. If they had prior history of opportunistic infection, patients should have completed acute and maintenance therapy and no active evidence of disease. Their CD4 count should be 200 or greater within 16 weeks prior to their kidney transplant. Viral load should be less than 50 copies per ml on stable antiretroviral therapy. Patients should be willing to use appropriate post-transplant prophylaxis if indicated. If you are a patient or a provider and is interested in our clinical program, we are offering face-to-face consultation, didactics, or e-life presentation. You can refer a patient to the Transplant Center by calling the number 1-866-925-3897. If you have any questions regarding the HIV disease donor transplantation to HIV-positive recipients, you can contact me or our study coordinator, Ricarda Tomlin. I thank you for your time to learn more about our program. We are looking forward to hear from you.